Sometimes people make a Medicare decision that they really, really regret. In other words, they're very disappointed in that choice. It could have been because they listened to an agent or maybe a family member, or maybe they just simply made an impulsive decision and now they regret it. So what can you do if you've made a plan choice that you regret and want to switch? When it's time for us to go on Medicare, we really only have 3 different options of using our Medicare benefits, and we have to choose which of these 3 is going to be best for us. So one option we have is to stay in the original Medicare A and B, and we enroll in that, but that's all we enroll into. We don't get any additional insurance whatsoever. All right, that's one option. The second option is to enroll in A and B, but instead of using Medicare, we use what is called a C plan, which is a private health insurance company that gives us what they refer to as an Advantage plan. That's one way in which we can use our Medicare. And then the final way, the third way, is to enroll in Medicare A and B. And we know that Medicare A and B doesn't pay for anything 100% other than preventive services. So what we do is to fill in the financial gaps that exist with A and B, we get what is called a supplemental plan. Supplemental plan. Now, most people today are getting a G plan or an N plan. Most still are getting G, but those are the top 2 popular plans today, but they fill in the gaps that Medicare did not cover. Now, anytime we have A and B in a supplemental plan, then we have a separate drug plan. We call these standalone drug plans. Most zip codes, we have about 15 to 25 different plans to choose from. Now, for drug coverage with the Advantage plan, what they do is they give us a C plan and then add a D plan as part of the package. It's just all in one. All right. So these are 3 options. And so if you've chosen one of those or getting prepared to choose one of those, and then someone decides they want to switch those plans, I'm going to show you how that works. So let's look at this first scenario, and that is that you chose to be enrolled in A and B only. Now, by the way, if you regret that decision, I found the majority of people who do this do regret their decision. So what are your options? Well, it actually just depends on when you started your Medicare. I don't know when you did, but let's just suppose that you started your Medicare A and your B 7/1/2023. Let's say those were your A and B dates. Okay, and so what options do you have? So first off, you don't have a drug plan, so we need to deal with that. And now you're responsible for all the gaps in your original Medicare. And this actually is what forces people into bankruptcy, truly. All right, so what are our options right now? So if you chose A and B only and you'd like to add a drug plan, the key date is your A date on this. And so we have, and the B date matters as well, but let's just use the A date since both are the same. So what we have is my A date is 7/21/23. So I have all the way up until 8, 9, 10. So I can still add a drug plan as long as I don't exceed these 3 months here. So you actually can enroll in a drug plan the last month of what's called your IEP, and you can start a drug plan 11/1/2023. All right, so now if you're beyond that, then that's a whole different story, because from this date forward, now what happens is you start having penalties. For every month you go without a drug plan, they add a 1% penalty to your drug plan premium, which is basically about 35 cents a month. So if someone goes without a drug plan for a year, it's going to cost them about extra $4 or $5 penalty every month for the rest of their life. And so that's why you get a drug plan. So the point is, we have all the way up to the 3rd month after our initial enrollment period to pick a drug plan. Now, if you're way beyond that, let's say you started your A and B 2021 and now you want to add a drug plan. There's only one time a year you actually can add a drug plan, and then it's October 15th through December 7th. All right? And so when you do that, then your plan will start January 1. So let's say you've been without a couple years. Now you're going to have probably about a $10 penalty added to your drug plan. But this is the only time that I can add a drug plan beyond my initial enrollment period. All right? So if you regret not having a drug plan, then this is the time in which you can do it. All right, so that's what we'll do with a drug plan. Now let's talk about, let's suppose that you have decided that you would like to get an Advantage plan. And so what's going to happen now is your Advantage plan, you actually have to enroll when you first are eligible for Medicare, unless you're coming off some kind of a group plan. And so if you want to add an Advantage plan at a later date, what happens, again, every year during the Medicare, it's called annual election period, we can add Advantage plans. Right? and there's no health questions asked. It just has to be an Advantage plan that's available in your zip code. We call that your service area. And you can add these plans, just like a drug plan, October 15th through December the 7th. And then that plan would start January 1. All right? And so if you decide that instead of getting a supplemental plan, you want to get an Advantage plan, you can do that every single year during the 7-week period. And then what you want to do is you want to get an Advantage plan that will also have within it a Part D plan. Okay, so that would be with a D plan. Unless you're a veteran or TRICARE for Life or FEHB, Federal Employee Health Benefit, Retired Civil Service, then you want to be sure there's a drug plan that's part of that package. So again, if you had A and B only, that's all you did, and you don't want to do a supplemental plan, we're just simply going to add an Advantage plan. We have these dates to do it. There's no health questions whatsoever. Now remember, you still will have a penalty. 1% for every month you went without a drug plan, then they're going to penalize you. So basically it's a $4 to $5 a month penalty then for the rest of your life, and that would be per year. Okay? And so that's if you decide you want to go on Advantage. Now, let's look at another option. So you made this decision at A and B only, and you decide that you would like to actually get one of those supplemental plans. You don't want to do an Advantage plan. You like the benefits of supplemental plans. So how does that work? Well, here's the way it works. Now our B date comes into play. And so what happens in every state but 4, because there's 4 states that you can actually get a supplemental plan anytime with no underwriting. That's New York, Connecticut, Maine, and Massachusetts. So beyond those states, the other 46 states, what happens is this B date determines when we can get a supplemental plan with no underwriting. And that period of time lasts for 6 months. 6 months. So if my B date is 7/1/2023, those 6 months would be this: July, August, September, October, November, December. So if I'm still within that 6-month window period of time, I can get any supplemental plan that I want. Any letter. Remember, there's 10 different options. Most people today are getting a G plan or an N plan, but I can have any sup I want that's sold in my state, and there's absolutely no underwriting required whatsoever. Okay? If that plan's sold, you can have it. We call that a guaranteed issue right. They, meaning the insurance company, has to write that policy. Okay, so that's any MedSup plan. Now, if I'm beyond this, so let's go back. I had a B date of 7/1. That's July, August, September, October, November, December. And that means that from January 1 on, this would be in my example here, 2024 on, if I want to get any supplemental plan, now what happens? I'm out of my no underwriting status. I'm out of that Medigap open enrollment period, and now I have to go through underwriting. So what happens now is we're going to ask you 30 health questions. We're going to check all your prescriptions. We're going to get a statement from your doctor. That's the underwriting process. And all that information, the health questionnaire, the prescription records, your doctor's statement, all that's going to be submitted to the insurance company that you'd like to go with. And now that company does not have to approve your policy. Unless they like all this, they can say, no, we're not going to approve the policy. So you have that underwriting process. And if you have bad health, such as maybe diabetes or AFib or something going on in your health, and they say no to you, remember, you can always get an Advantage plan with no health questions asked. So if this is no longer an option for you because of your health, then October 15th to December 7th every year, you can add an Advantage plan that would go into effect January 1. But again, the supplemental plans, if you like the features of that, which there's a lot of great features of a supplemental plan, then either we do it during the first 6 months, or as long as we're halfway healthy, we can add it later, but we do have to go through underwriting. And you can do this at any time you want. Okay, anytime you want. All right, there's no time limit to adding a Medicare supplemental plan. Now keep in mind, New York, Connecticut, Massachusetts, and Maine, there's never underwriting in those states. All the other 46, you're underwriting after 6-month window. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. Now let's look at our second plan option. That's someone that chose a Medicare Advantage plan and would like to change and get off that plan. And so there's one of 2 options we have. Either we can change Advantage plan companies, or we can actually get off an Advantage plan and get a supplemental plan. All right, so I want to address those two, but I got to separate these first. So let's talk about changing Advantage plan to Advantage plan. So let's go back to my original example. We have an A and B date of 7/1/2023, right? And you chose to be on an Advantage plan, but maybe you chose an HMO and you would like to have a PPO, or maybe your doctor was taking the plan and now the doctor's getting out of the network and now you got to switch doctors. You don't want to do that, so you're just going to switch plans to find a plan that your doctor is in. That means we're moving from one Advantage company to another. We're moving from United Healthcare to Aetna. We're moving from Humana to Cigna. We're moving from WellCare to Blue Cross, whatever. You're making a switch of the plan. And so here's the rules for that. You're on an Advantage plan, so you can actually switch plans October 15th through December 7th. And if we make a switch during that time period, we call this the AEP, the annual election period. When you make a switch then, that new plan, new company you chose will go into effect January 1. That's one opportunity to switch Advantage to Advantage. Another one is actually called the Medicare Advantage OEP. Now, in this one, I cannot add an Advantage plan, but as long as I own an Advantage plan on January 1, that means January 1 all the way to March 31st. January 1 to March 31st. What I can do is one time I can switch during the Medicare Advantage open enrollment period. I've got to be on Advantage plan January 1, and if I make a switch in January 1, my new plan I pick will go into effect February. If I make the switch in February, my new plan will start in March. If I make a switch in March up to the 31st, my new plan will go effective in April. So I have this 3-month window every year at the beginning called Medicare Advantage Open Enrollment Period, where I can switch from one Advantage to another Advantage plan. Depending on when I make that switch will determine when I'm going to start on my new plan. Okay? And so up here, I make the switch October 15, December 7, goes into effect here. But on this, that's going to go into effect the following month. Now, let's say I decide in May I'm unhappy with my plan. Can't do anything about that because we're beyond this open enrollment period. We'd have to wait until the following October 15th to be able to make that switch. So that's Advantage to Advantage. We can make those switch 2 different times a year. Now, let's suppose that you're on an Advantage plan, and what you would like to do is actually switch to a supplemental plan and then add a prescription drug plan. And again, this is going to be a timing issue. So here's what happens. If this would be your A and B date, and let's say that now we're 1/1/2024, and you would like to get off your Advantage plan and move to a supplemental plan, what you have here is you're in what we call your trial period. Trial period. And this trial period actually lasts for 12 months. So once you've started an Advantage plan, you started that Advantage plan when you first turned 65 and you chose an Advantage plan. During the first 12 months, if you find that you're not happy with that Advantage plan, you actually can get off the Advantage plan. So we're on Advantage plan, okay? And we're still in this 12-month trial period. We actually can cancel this and we can move to a Medicare supplemental plan, and we can pick a MedSup plan, and we still have no underwriting whatsoever, okay? So no health questions are going to be asked, no prescription will be checked. The insurance company has to take you, all right? So that's one option we have if we're still within the 12 months of that original trial period. But let's say that we're not. Let's say we're beyond that. And now we've been on, let's say we're on this Advantage plan now, and it's 1/1/2025, okay? We're way beyond our 12-month period of time. And now what we want to do is we want to switch to a supplemental plan. So here's what happens in this scenario. What happens is now I have to medically qualify to get off my Advantage plan because this trial period is over. I'm well beyond the 12 months. I want a supplemental plan. So what's going to have to happen? We're going to have to ask you 30 health questions. We're going to check all your medications, and we're going to get a statement from your doctor. And all that information, again, has to go to that supplemental company for underwriting. And if they approve the case, you'll get that supplemental plan. But if they don't like the way you respond to the health questions, they don't like your pre-existing conditions, you're on some medications that they're not comfortable with, they actually can deny that case, and they do not have to approve you, and then you'll just have to stay on your Advantage plan. Now keep this in mind, if I'm in a period of time beyond my 12 months now, I can only make this switch off Advantage to supplemental plans. I can do it October 15th through December 7th, okay? Plan goes into effect January 1, or again, I can do it January 1 to March 31st, and a plan to go into effect whatever, the next month that I disenroll from this. So my whole point is I have two different windows where I can get off my Advantage plan, return to original Medicare, get a supplemental plan that I have to medically qualify for, of course, unless you're in New York, Connecticut, Massachusetts, or Maine. All right? In those 4 states, you don't have to qualify, but all the others you have to qualify. But again, we can only do this during this time of the year. And then keep in mind, when I make this switch to get off my Advantage and I do medically qualify, then I can actually add any Part D plan that I want. Those are called Part D plans. And there's no health questions that's part of that process at all. If it's available in your zip code, you can add the Part D plan. So this is someone that started with an Advantage plan, wants to pick up a supplemental plan. So if they're within the first 12 months, no underwriting. After 12 months, except in those 4 states I mentioned, you're going to have to go through medical underwriting before that supplemental plan will be issued. Now, before I leave this switching of the Advantage plan to supplemental plan, I want to mention just a couple things why people do this, because we have this happen all the time. Number one, people do it because with the Advantage plan, they have to have a network. Advantage plans have HMOs or PPOs. If I switch to a supplemental plan, I have no network at all. And that's why people like to make that switch, because they don't want to deal with limitations of doctors and providers and hospitals and all that. So when they go on original Medicare and get a supplemental plan, they have no networks. That's one reason people make that switch. The second reason, which is probably the biggest reason, is that Advantage plans have pre-authorizations. And it's about 72% of the services on the Advantage plan, a pre-authorization is required, which means that your doctor says you need a knee replacement, hip replacement, doctor says you need an MRI or CAT scan or some skilled nursing stay, but they require you, they recommend you have a service, but that's a pre-authorization. The insurance company has to approve what the doctor's recommending. And frankly, sometimes they approve them immediately. Sometimes they delay them and say, no, we want you to go to rehab first, or we want you to try medications first. And sometimes they just flat deny it, say, we're not going to cover that knee replacement. We don't think you need it. Or that hip replacement, the doctor says you need a full hip replacement. We'll pay for a rod, and that's all we're going to pay for. And so the point is, with Advantage plans, you have pre-authorizations on 70 to 72% of the services. And a lot of people don't like those limitations. They don't like the fact that their doctor does not have the final answer. The insurance company does. And so what happens when you take a supplemental plan, that insurance company has no pre-authorizations whatsoever. If your doctor says you need a knee or hip replacement or a CAT scan or MRI, Medicare says they'll cover it, end of story. That insurance company has no say-so whatsoever, but they do on the Advantage plan. And then lastly, what happens, the reason people like to get off of Medicare Advantage plans is because Advantage plans are only written for 1 year at a time, and they're tied to a service area. They're not really tied to you. You leave the service area, you got to get a new plan. It's 1 year at a time, and the plans come and go. Companies come and go. Doctors change networks. Sometimes they'll take the plan, the next year they won't. So it's a very fluid type of insurance. Okay? But what happens if you get a supplemental plan, supplemental plans are the same coverage nationwide because it's Medicare. Okay? Any doctor takes Medicare will take your supplemental plan anywhere in the country, and it's a lifetime policy. Lifetime. It's not 1 year. As long as you pay your premium, that insurance company can never cancel that supplemental plan. So that's why these 3 reasons are the main reason why people get off Advantage plans and want to move over to supplemental plans, because they don't like these particular features here. They'd rather have insurance that has these features here.
Hey, my name's Josh Musick, and if you've been enjoying my dad Marvin Musick's content, you really need to go to our website, MedicareSchool.com. When you go there, you'll be given the opportunity to download a free 1-hour Medicare Essentials workshop, and it's going to take you all the way from Medicare A to Z. By the time you're done watching that workshop, you're going to know how to enroll in Medicare, when to enroll in Medicare. You're going to know the difference between Advantage plans, supplemental plans. You're going to know how to get drug coverage. You're going to know everything you need to know to get the best coverage possible. So go ahead, go to MedicareSchool.com and watch the Medicare Essentials Workshop.
That brings us to our third option, and that means this is someone that enrolled in Medicare A and B, and they chose to have a supplemental plan. As I said, most people now are getting a G plan or an N plan, and then they added a drug plan to that particular coverage. And so now they've chosen that plan and they're disappointed. Now, I will tell you this, rarely is someone ever disappointed in the way a supplemental plan is going to work, because if Medicare pays, the supplemental plan is going to follow, filling in the gaps. If you get a G plan, the only thing you're out of pocket right now is once a year, a small deductible. So that's with the G plan. You have a small deductible called the B deductible, and that is $226 this year for the whole year. That's it. Everything else is covered by the supplemental plan. If you get an N plan, you're responsible for the B deductible and then excess charges. That's the extra 15% that a doctor can add to the bill. So the N plan covers 4 of the 6 gaps. G covers 5 of the 6 gaps. And the N's about $30 a month cheaper than the G. So if you want a little bit more risk and you're willing to take on the risk of excess charges, some copays for doctor visits, all that, then you may want to get an N plan. If you just want no surprises and you want to pay once a year a small deductible, then I'd get the G plan. You'll pay another $30 more for it, but again, you always get what you pay for. All right, so my whole point is if you get a supplemental plan, what's happening here is if you want to switch supplemental plans, almost always it's because you went with a company that is unstable, meaning their rates are not as stable as what you would like. And again, that's why when we work with clients, we don't just look at the initial premium, we look at how that company has performed over the last 10 years, how many times they've taken price increases, because everything goes up because of medical inflation, but some companies tend to be more stable than others, and that's the carriers that we really prefer our clients to choose. Why? Because we know they'll be happy long term. So let's say you went with a company that is unstable, meaning they had a low initial rate, but now those rates are starting to go up. Now here's what happens. If you want to switch from a SUP to a SUP, the key date is your B date. So your B date. If you are still within 6 months of your original B date, remember my example, 7/1/2023, that lasted all the way through 12/31/2023. If I'm still within that 6-month window, I still have no underwriting required. 6 months of my B date. No health questions, no prescription checks, no doctor statements, nothing. But if I'm beyond that, which in our example earlier, 1/1/2024, if I'm beyond that now, 6 months of my B date now, except in those 4 states I keep mentioning, New York, Connecticut, Massachusetts, and Maine, in those states, you don't have to go through underwriting, but all 46 others, if I'm beyond 6 months of my B date, now we got to ask 30 health questions, check your meds, check your doctors, and now we have to go through underwriting. And as long as that company approves me, I can make that switch, and I can do it at any time. I'm not bound to any enrollment periods whatsoever, like I am on those Advantage plans. Okay, I can do it anytime you like to, but you got to go through medical underwriting. And again, sometimes it's worth it to move from a company that hasn't been stable to a company that's proven to be more stable. Maybe you'll save a little bit of money, but more than anything, you'll get more of a stable rate, and that's what matters. Okay, and so there's people that have to make that switch. And I do want to clarify something. There are 8 states that have what we call a birthday rule. Birthday rule. Missouri calls this an anniversary rule, but there's 8 of the states. Okay, and let me just mention them since I'm almost running out of board. Here they are: Washington, Oregon, California, Nevada, Idaho, Illinois, Louisiana, and Missouri. Those 8 states, they have this thing called the birthday rule, and Missouri calls it the anniversary rule. But basically what this means is there's a period of time in your state where you actually can switch supplemental companies. Now, if you're on a G, most of these states make you go to another G, or a G down to an N. So you move like product to like product, you're just simply changing companies. and so you're moving that policy around your birthday. Some states it's 30 days before your birthday and then 30 days after. Some states it's 60 days from your birthday, but it's usually tied to your birthday. Missouri ties it to the anniversary of your policy, not your birthday. But again, it's all about switching, moving like to like or like to less for the purpose of saving money. And during that window, if you're in a birthday state, anniversary with Missouri, then you don't have to go through underwriting if you try to make that switch from one company to another or one plan to another during that period of time. No underwriting required. Now you can make the switch other times of the year, but beyond birthday and anniversary rule, now we have to medically qualify to do that. So again, there's those 8 states. Then you have 4 states you never have to do that, which means once that's 12, so that means we have 38 states that require, if you ever want to switch supplemental plan to supplemental plan beyond your 6 months of your B date, now we're going to have to medically qualify to do that.